your particular employer group. Today's webinar is going to be fairly short. I'm going to do this in less than 25 minutes, 20 minutes maybe. Towards the end of the slideshow, there'll be some numbers where you can contact me. It's an email address. If you'd like to have a private demo directly discussing your particular employer group and the personality of your healthcare platform. Okay, so if you don't know who MD Live is, we are a privately held Florida-based healthcare technology company. We provide 24-hour, 7-day-a-week, 365 days a year on-demand access to affordable care. We have a network of highly qualified, state-licensed and board-certified physicians and therapists. You can contact an MD Live physician either by telephone, secure video, or email. Secure video meaning you can have a face-to-face chat with the doctor in real time for low acuity type conditions like a cough, a cold, or the flu. And I'll talk more about what the application for telemedicine is as we go through the slideshow. Our MD Live Vault is just simply our website. There's a back office portal which allows your employees to have access to their own personal health manager, and I'll show you a couple examples what that looks like. People ask all the time, well, telemedicine, I'm seeing a doctor over the internet, I've got a cough, I've got a cold, I've got the flu, I need an antibiotic, I need a Z-Pak. Can you prescribe drugs over the internet? The answer is yes. Non-controlled substances are appropriate. We can prescribe those, things like Valium and Vicodin, those sorts of things. We cannot prescribe that, but if you have pink eye and you need some drops, or if you have the flu and you need a Z-Pak or an antibiotic, we can do that. We have a health reference system checker and educational library. I'll show you a couple pictures of that as we go through. Basically, this is the back office portal that's available for all of your employees to have access to doing a better job of managing their health, which in turn will help save you money as the employer. It is private, it is secure, it is confidential. This is all HIPAA compliant. There's lots of regulations now throughout the United States, and I have a slide coming up that will address the regulatory environment, what you have to do to become HIPAA compliant and follow all the rules that are laid out for us. These are some of our customers. These are companies that we have contracted. MD Live only contracts or gives access to our physicians through employer groups. And up until now, we have not marketed to any other companies other than the Fortune 100 type of companies that you see on the screen here today. Now, obviously, if you are an employer group with 300 employees or 500 employees, that was not a segment of the marketplace that we have focused on. That is changing in midway through 2014. We'll continue into 2015. So we're making it available to smaller employer groups. But our customer base is made up of companies like this. We have over 1 million people contracted throughout the United States. Companies like Qualcomm and Tyco and Honeywell, Humana. You see some health insurance companies here that we do partner with. So we provide our services through an employer group, and I'll describe a little bit how the employer group pays for that, gives access to their network of employees, and how ultimately it can benefit them as well as it can benefit you. For the moment, I'm going to stick with what we do and how we do it. Our management team, family practice, internal medicine, pediatrics, and emergency, they are state licensed, board certified, credentialed physicians. They do obviously adhere to the highest quality standards by the NCQA, the URAC. Background checks with our primary source of verification. We re-credential our physicians every 36 months. They have an average experience of 15 years. There's one of the most common things that HR directors will ask me is, what about insurance? What about malpractice insurance? We're seeing a doctor via the internet or a telephone line. There's two different types of malpractice policies. First of all, a physician will carry their own malpractice insurance policy. And MD Live also provides a malpractice policy per encounter. So every encounter your employee would have with one of our physicians would have a malpractice insurance policy provided by MD Live as well as by the physicians themselves. They specialize training in communication and diagnosing patients over the phone and through online video. Yes, these physicians are trained to diagnose and treat people with a low acuity type of condition. They can have these types of issues corrected and addressed without having to leave the workplace, leave their place of their desk, leave their office for 4 to 6 hours or an entire day to see a physician in the emergency room or their primary care physician for something that can be simply treated in a 15-minute video chat with the doctor. Have the conversation with the doctor diagnoses the condition, prescribes an antibiotic, It's then emailed into their local pharmacy of their choice. They pick that up on their way home, and they've never left the workplace. We'll talk about how that benefits you and way of costs and whatnot as we go through this presentation. The U.S. regulatory landscape, really interesting in 2014. Telemedicine is really being embraced across the country. If you just Google telemedicine, you'll see a lot of stuff come up on it. But the government has really gotten behind telemedicine with Obamacare in full effect now. It is more and more necessary with more and more people going to the doctor to find other ways for people to get access to a doctor without crowding up the emergency rooms. 21 state governments and growing now mandate some form of private payer reimbursement for a telehealth visit. Oklahoma was one of the last ones to kind of join the party and allow for an in-person relationship with a patient prior to using telemedicine. State telemedicine regulations are centered around licensing of physicians and electronic prescribing by providers via telehealth. Again, if you Google telemedicine, you'll see the telemedicine is being widely embraced, not just in the governmental community, but also in the medical community, because it provides a lot of advantages for you, the employer, with regards to controlling your healthcare costs. These are the states that we can provide full-service healthcare in. Now, obviously, if you're in Texas, Oklahoma, and Louisiana, those visits can only be done by phone. We cannot do a email chat or a video chat and a face-to-face encounter. We're using a front-facing camera on your desktop, your laptop, or even your cellular device. In those states, we can only provide it via the telephone. But the rest of the countries, you can see there for the bulk of the country, I think that's something like 43 of 50 states, do provide full services, video, as well as telephone line. And here's some of the things that we treat. Now, this is only a small sampling. People say to me, well, why would I go to see a doctor on the internet if I've got a headache, or I've got a sunburn, or if I have a sore throat, or an ear infection? Believe it or not, statistically, 67% of what you would see a doctor for in the emergency room can actually be treated by a physician online, and which is why you're seeing such a tremendous push towards telemedicine. But these are the kinds of things. These are considered to be low acuity type of conditions. We're not meant to replace the emergency room. We're not here to replace the primary care physician. MD Live provides this service in order for your employees to be able to stay in their workstation versus running out the door for something that is in one of these categories, which is going to save you money as the employer and will inevitably drive down your health insurance costs, because if someone's going to the doctor because they have a cold or a flu just to get a Z-Pack, well, they can do that on the internet, and I'm going to talk about costs here in a few slides. You're going to see just how amazingly affordable this actually is. Continuity of care, just to give you just an idea of how it works. A patient sees the physician on the internet. Let's say it's a face-to-face encounter. Most of our employer groups will set up things like virtual offices where there's a computer set up with the MD Live link already set up and ready to go. Somebody is sick in the workplace. They just walk down the hallway, log online, see the doctor. They have their username, their password. They get into the system. They see the physician. Once they're done, the employee will receive discharge instructions via their patient portal and secure email. Their personal health records will get updated with the consultation information. The members receive a PCP, or receives a consultation history and SOAP note. Their medical file is updated, and their primary care physician is notified that this visit took place. The employee had a cough and a cold and an ear infection, and the doctor prescribed these antibiotics to address the condition. It's all done via secure email as well as in the employee's private patient portal. We have 3 call centers. We own these call centers. When somebody calls into an MD Live call center, they're not calling offshore. They're calling one of our manned centers. There's 3 of them throughout the United States. These are on-site medical trained healthcare services call centers is what they are. So somebody calls in, they have a condition, they want to make sure that it's appropriate to have a telemedicine visit, not go off to the emergency room with their primary care physician. You want to see this almost as triage. You go into the emergency room, they give you a clipboard, you tell them what your symptoms are, what your condition is, why you're there to see the doctor, then the doctor will see you. This MD Live is exactly the same thing. The only difference is it's all done online. You contact one of the call centers, you tell them your condition, they then set up a web consultation or a telephone consultation, but they walk you through all this stuff. 100% healthcare industry focus. They're trained to express empathy and patience. They will answer members' health questions, take personal health histories. It's a triage with nurses and doctors, and it's obviously multilingual and TDD enabled as well. So it's sort of a new approach to e-therapy, and this is becoming something that, especially in the last few years, when we've seen so much in the news about behavioral health and the ability to see licensed therapists or behavioral health consultants. And so MD Live does offer this. It's not generally part of our main package, and I'll talk about pricing here in a few slides. But these types of things are becoming more and more common in our society today. Relationship and family issues, stresses and challenges of everyday life, child behavior and learning issues, parent counseling, problems at work, coping with illness, financial problems, marital problems. These are the kinds of things that people may need to see a licensed therapist for, and we do offer this. Again, it comes in a different pricing package, but we do offer it, and we do encourage you, if you have a population of employees that may suffer from some of these types of conditions, that you discuss this way that we can make this counseling available to your particular employees. Yes, we do now have an MD Live app. This is very cool. We were doing a health show with a company called Intuit just about 2 months ago, big software company down in San Diego. We unveiled it then that we now have our mobile app available for you to be able to simply download the MD Live app right to your iPhone. In this case, that you're looking at here, it's a phone line app, it's an iPhone. And so you download the app to your iPhone. When you want to see the doctor, you press on it. You get an idea here from the screen on the right-hand side. Which doctor would you like to see? Would you like to see Dr. Stephen Gerlin? Would you like to see Dr. William Brown? Or would you just rather see just the next doctor on call? Who's the next doctor available? We'll click on that, and you'll be able to see that physician using your front-facing camera. And if you have a population of employees that are in the younger realm, and by younger I mean under 40, they so totally get this. They love this app. It's been extreme. We've worked on this for a number of years, but it is now available. But it does give you access to online care at home, at work, or on the go. Telehealth is in the palm of your hand. If you need to see a doctor, you don't have to get even to a desktop. You can schedule your appointments, send and receive secure messages, and get access to lab tests and medical files, all from your mobile device. Dr. Travis Stork is our corporate spokesperson as well as our chairman of MD Live's Medical Advisory Board. He does a lot of public speaking for us. He's been in a number of interviews for MD Live. If you Google Dr. Travis Stork, you will see some interviews that he has had with different publications about the importance of not just telemedicine, but what MD Live does that sets MD Live apart. And there's a number of things that we do that are quite a bit different than what some other folks do. We are the largest telemedicine company in the world. We only have really one major competitor in the larger marketplace. Most of the telehealth groups today are relatively small. We're one of the larger ones. We're certainly fortunate to have John Scully. If you don't know who John Scully is the former CEO of Apple, as well as Pepsi-Cola, I believe. But John Scully's been a tremendous spokesperson, not just for MD Live, but for telemedicine. He made a comment to Forbes magazine just a number of months ago. If you want to Google John Scully and Forbes, he talks about telemedicine. He talks about MD Live, what MD Live is doing. He sits on our board of directors. He's an investor in the company. But he made a very bold statement. He said telemedicine will have a greater impact on society than Apple did. And just think of the significance of that statement. So John Scully is part of our management team. We are fortunate to have him with us. Program media, very, very important. A lot of people say, well, okay, so you sign us up, now what? How does it work? Well, the one thing we don't do is just sign you up and say, well, you now have your employees now have access 24/7 to a physician online or over the telephone, and then walk away. We are not a hang a poster on the wall kind of company. We charge $5 an employee one time to send out a media kit. So every employee will get a media kit. That is going to be the card, like you see down here, the little thing that you put on your key ring. Okay, it'll be that. There'll be some brochures. There'll be some descriptions of why you would now have MD Live and how it benefits you. The idea, of course, is to drive people away from using the emergency room or their primary care physician or urgent care for something that they can be cured and be dealt with and addressed in literally a 15-minute call with an MD Live physician. So the idea is to drive people away from using those types of applications when they can get access to a physician by sitting at their desk or using their mobile device. So what we do is we market very heavily. We work with the HR directors, with the HR team to implement a strategy and a plan. Yep, we do health fairs. We've done a number ourselves. They're exciting to do. So there's a number of things that we will do, but the key is to, again, this is about controlling your healthcare costs, even lowering your healthcare costs, and you'll do that by taking people and driving them away from those doctor visits that can be extremely expensive. If you're a self-insured group, if your employees are self-insured or your company is self-insured, then you know that when that employee goes to the emergency room because they've got a cold, that's going to cost you $300 to $800, depending upon the part of the country that you're in. That's expensive. Now, when I show you what the cost of this is, you're going to go, that's significant savings. Yes, they are significant savings. Is it convenient for the employee? Absolutely, it's convenient for the employee. Is it convenient for your employee's spouse who has a child who has an ear infection from swimming and just needs some ear drops? Absolutely it is. But the key for MD Live and for telemedicine is to drive healthcare costs down by moving people away from those visits to the emergency room or their PCP for a low acuity type of condition. We do a lot of marketing with the employees to drive them away from those types of visits. So cost. One of the reasons we wanted to do this video today and send it out was because we've been asked a lot about cost. And sometimes people don't want to get on to a 1-hour webinar. They'd rather have a 20-minute dissertation on how telemedicine works and then learn about the cost in that manner, and then maybe schedule a private demo with your group. But cost, this is what I think is most surprising about telemedicine. It'll fit into really any healthcare package that you may have, whether you're fully insured or self-insured. As little as $250 per employee per month. You can add telemedicine to your current program. This will not include the consult fee with the doctor. The consult fee with the doctor is $38. That cost of $38 for the consult fee can be either paid by the employee or by the employer or a combination of both. And just to give you some examples, some of the larger companies will generally pay that consultation fee. Why? Because they know $38 is a lot less than a visit to the emergency room, so they're glad to pay it. Other groups, in particular places like restaurant chains, who has a lot of part-time employees, maybe a lot of college kids, these people aren't insured, and so for them, they say, okay, you know what, we're going to pay the $250 a month. We're going to give you access to a physician for these low acuity type conditions. You will then pay the consult fee. But for the employee, a $38 consult fee is a lot less expensive than paying a copay in an emergency room or going to urgent care. Urgent care is certainly going to be more than $38 regardless of the part of the country that they're in. So it's a win-win each way, or it can be done a combination of both. Maybe the employer group rather pays the $250 a month, and maybe they split the consult fee. Or maybe the employee pays all of it, or the employer pays all of it. But still, it's a relatively easy way and cost-effective way to get access to a physician 24/7. Now, for as little as $490 a month, you can provide unlimited access to a physician 24/7, 365 on an unlimited use model. So it's an all-you-can-eat model. $5 per month per employee, which includes spouses and dependents. For $5 a month, they've got access to see a doctor on an unlimited model. Now, obviously, every employer group's a little bit different. Now, maybe if an employer group, let's say, for example, has a fully insured plan through Kaiser, and they want to offer their employees telemedicine, they can simply sign up, and the employees would then pay the $490 per month fee. That's one way to do it. Or if the employer group finds that the presenteeism issue is as important as $5 a month, that if you can keep your employees in the workplace, it might be worth $5 a month to invest to give them access to that physician without having to leave the workplace to have something that could be addressed over the internet done in the emergency room, taking them out of the office for 4 hours or even a day. And then, of course, you have the employees that, for convenience sake, just don't want to go to the doctor, right? Because it takes a day or 2 or 3 to get an appointment. It's crowded. There's lots of sick people in emergency rooms. They don't want, so that $5 a month can be an extremely cost-effective way for someone to have this entire model available to them in a way that's extremely cost-effective, whether it be paid by the employer or by the employee or a combination of both. Now, these numbers are subject to change based on volume of employees. That just simply means the number of employees will determine that cost factor. So the more employees, obviously, the more these numbers can go down. The behavioral, the medical and therapy services, behavioral health services, those will be negotiated on a case-by-case basis. So it depends upon your own particular health care needs. Some employer groups don't need that. I will tell you, though, in the last 18 months, we've had more and more people inquire about how we can structure access to a behavioral health physician within the confines of your current healthcare platform. So as you can see, it's extremely cost effective. I want to thank you for joining me. This was a very short webinar. I'm glad you were able to be on and check it out. If you would like to be able to have a live demo, which would be questions and answers, analyzing your particular health platform, your particular set of healthcare needs, your particular structure of your healthcare plan, we can do that. We do live demos every day with folks that want to discuss how this can benefit them. There's no cost to them. It's just an opportunity to learn about how something might be a good fit for your particular group. And we do that simply by scheduling an appointment. You can call me at this number you see on the screen here, or ccastro@mdlive.com. Either one, just contact me, and we'd be glad to schedule a private demo. So with that, I want to thank you for joining me today. We hope you have a wonderful day, and we certainly hope to hear from you sometime soon.